Hi, I'm pleased to introduce myself as Dr. Neelam Mohan, Senior Director of Paediatric Gastroenterology, Hepatology and Liver Transplantation at Medanta, the Medicity, Gurugram. Hepatitis is inflammation or infection of the liver. It could be due to infections, which could be like viral mostly or bacterial. It could also be due to some drugs, toxins, etc. But most of the time, when we say viral hepatitis, we are talking of hepatotropic viruses, hepatitis A and E spread through contamination, food and water. So, to identify and prevent them, we need basically to focus on sanitation, hygiene of food, water and hand. Hepatitis B and C, on the contrary, are not food and waterborne. They are transmitted like HIV through contaminated needles, pricks, unprotected sex, or from mother to a baby. It is very important for us to realize that if we want to eliminate viral hepatitis, especially B and C, we need to look not only at the horizontal transmission, that means where we can get infection through contaminated needles, pricks, through dialysis, while you're probably filing and your nails, your dental things. And the most important part is to identify those mothers who are positive and prevent their transmission to the babies. This is called the vertical transmission that one needs to focus to reduce the burden of viral hepatitis in any country or globally. The steps that a mother can take is, one, we don't want her to get infected with, either an acute hepatitis B or C. So, taking precautions in her lifestyle, which is like avoiding contaminated needles, getting those injections like, they need tetanus injections and all. They have to be ensuring that they are using disposable needles, and any unwanted pricks which can be prevented, tattooing, ear piercing, filing. You're not sure how those instruments that are being used on you, because you'll be surprised that even a small drop of dried blood, the virus can be alive. In hepatitis B, it is alive as long as a week, like HIV, and in hepatitis C, it could be alive as long as 6 weeks. And the other is unprotected sex from someone who could be infected with hepatitis B and C. So these are the precautions that she would take to prevent getting an acute infection in her. Secondly, it is very important that every mother is screened for hepatitis B and C. It is only through the screening that you will identify she's positive or not. So when we screen the mother, we get to know whether she is positive for hepatitis B and C. Similarly, we also do some tests to see what is the replication state of the virus. Is the virus replicating very fast? Then the risk of transmission to the baby is going to be high because the virus is replicating. And also the pregnancy from the mother's point of view, it is important to know whether the mother has just got a mild disease or a severe liver disease, because in case she's already suffering from a severe liver disease or cirrhosis, then it is very important for the mother to be in constant touch not only with the gynecologist or obstetrician, but also with a liver specialist who can give adequate management of the mother per se, to ensure that she has a safe delivery and a liver disease is taken care of. And then comes the role of a pediatrician, that soon after birth, the pediatrician takes over to prevent the transmission risk to the baby. If the mother has got liver disease significant, there is risk that she could have a premature baby, there is risk of abortions. So we need definitely to be taking care of the mother if she's already a diagnosed case of hepatitis B or C. Globally, the burden of viral hepatitis is very high, and now the WHO goal by 2030, we want to eliminate viral hepatitis. Viral hepatitis spreads horizontally, especially B and C. Horizontally is you acquire an infection through contaminated needles, pricks, unprotected sex, that is that. But in addition, my message to young mothers or young women who are planning their pregnancy is there is a huge component of risk to the newborn baby through vertical transmission. That means in utero or soon after birth, you can give the infection to your baby. So it is very important for all mothers, all pregnant ladies to get their hepatitis B and C screening. And in case you know already that you are positive, then again, besides the obstetrician, meet a hepatologist and take care of yourself. If you get to know for the first time that you have hepatitis B and C or C through screening, then please ensure that you need to consult a liver specialist to take medicines called antiviral medicines in the last trimester, so that the risk of transmission to the baby is reduced.